So far as ST segment is elevated, and if you see somebody with chest pain and ST segment levels are elevated, you are concerned and you want to call your cardiologist as quickly as possible. If there's no ST segment elevation and you do your cardiac biomarkers, then that helps you to know whether this patient is having an ST. In fact, this is very common in Canada. So don't just depend on the ECG and say that, oh, ECG is normal, therefore I'm not going to do anything. No, even if your ECG is normal, still go ahead and get your troponin level. What you want to do is, when did the chest pain start? Now, you want to repeat the troponin level in the evening before the patient goes home. So, acute coronary syndrome will usually present substernal or left-sided pressure or tightness. So that's something I want you to note, because at the end of the class, we will also be doing the active rep. Now, in acute coronary syndrome, you realize that the pain builds up gradually. It builds up gradually. And this also helps you in the board exam to help differentiate between acute coronary syndrome and other causes of chest pain. It is worse with exertion or radiates the shoulder. And so if the patient tells you that, or you see that in your board exam, that should help you to increase your suspicion of possibly an acute coronary syndrome is going on. The patient may have atypical symptoms like shortness of breath, weakness, confusion, or fainting. And you see these atypical symptoms in older adults, as geriatric patients. Number two, women and diabetics. So please, these three, shortness, weakness, confusion, or you may see this in older adults, women, or diabetics. Some older patients may not even have any chest pain in acute coronary syndrome, and they may just have something like, oh, confusion and fatigue. Please, some of these things, don't say, oh, the patient is just tired, the patient just has some dehydration, let me just give some IV fluids and let the patient go home. No, that is very deadly. So remember all the time in your board exam that you can have a patient who may not present with chest pain, but the patient is a geriatric patient and the patient just comes in with confusion or fatigue.